Communications and engagement is essential for success of any organisation, regardless whether or not you're in the NHS or outside of the NHS. So we use very much an insight model where we use information and data to then target our messages more effectively, which allows us to engage and involve patients more effectively. Phase 1 of the vanguard process was the opening of our new hospital in Cramlington, which is a specialist emergency care hospital. And that required a lot of communications and engagement activity because it was a major change in our local communities. The work has been really successful. We have touched thousands of individuals. We've been in every single community. We've been transparent, we've been visible, we've been very open, and we've focused our communications to not only win hearts and minds but also change behaviour. Our next phase of the vanguard is primary care at scale, and our communications now not only is still continuing on phase 1 because it is a continuous process to communicate and engage about our new hospital, but also it will move on to primary care at scale, supporting patients and the public, getting them involved in how we co-design and redesign the pathways of care. So we are now researching with our local communities to understand how they want to access primary care, understand when they want appointments in primary care. Do they actually want a 7-day service in primary care? We have 4 localities, so what we try and do is engage people within them 4 localities, which are different areas within Northumberland, to support how we evolve our services before we even develop the plans to change them. So they are well and truly involved in the process of change and the evolution of change before plans are developed. It's a pleasure to be part of the Vanguard project. This is a real opportunity to get people working together, ultimately to integrate care for Northumberland, but also to get teams working together to make sure that we have that common objective to transform health and well-being of the population. And it's really exciting for comms and engagement to be part of that. And for Northumberland, we absolutely are. And supporting the national work is really exciting too. It also helps other vanguards learn from us, and that collaboration is really supportive of a joined-up health service.